Okay, we're going to look at some long traction techniques now to separate the vertebra, superior from inferior or inferior from superior. The indications for doing this are either an anterior subluxation, the way we have it modelled, or a transverse subluxation. So that we'll look at the assessment for these first. First, the transverse subluxation. This is most easily picked up in the position testing method of doing this. So we'll get them to flex all the way down, and what I'm looking for now is a vertebra that is posterior in flexion in one direction, and also found it in extension, same direction. So we've got one that may be this. So I've got the left transverse process posterior at this level here, and in flexion it's posterior as well. So it's sitting like that regardless of whether it's flexed or extended. Now, the minor model works is this, that this vertebra has shifted and locked one side or the other. If it's gone to the left, it's rotated to the left as it's done so. If it's gone to the right, it's still rotated to the left. And we don't actually know whether it's gone left or right. Some of the theory says one thing, some says another. Don't worry about it. Because what we're going to do is we're going to test that vertebra directly. Its ability to translate left and right. And then we'll make the decision as to whether or not this translation has occurred based on that assessment. So the position testing gives us the level that we're going to test definitively. Now to check this, I need to stabilise the whole segment because the ribs have gone with it. So what I'm going to do is, this is the vertebra of interest at this level here. I'll stabilise below it, so my thumb goes against the spinous process of the vertebra below, and this one will reach around and grab its rib there. And then all I'm going to do is I'm going to push through the arm and see if it will translate to the right. It's this test. And I can compare it with the one below this and the one above it. And if you notice, what I'm doing with my hand is shifting this up and down to test it. In actual fact, this isn't gliding in that direction. We'll come a little bit higher, it glides. If I come back onto this, it doesn't glide. So it looks as if this is jammed to the left, but to test to the right, I'll stabilise the right side there, the rib, and come around and basically push it to the left there, and this is gliding. So what we've got is basically the vertebra as subluxed to the left and rotated as it's done. So this is my target. The other thing that may have happened here is that, or another reason we may use this technique rather, is that the vertebra is subluxed anteriorly. So you've got a bilateral flexion subluxation or an anterior subluxation of the vertebra. This one you can't pick up with position testing because it's a symmetrical dysfunction. So there's a couple of ways of picking it up. One is through the pivums, in which case bringing your arms up, and this will not be able to extend when I extend to the left, or when I extend to the right. This will not be moving into extension. The other way I could do this is to do PA. So I do a PA on the superior vertebra of that segment, which will move and may be extremely painful if this is a painful dysfunction. But it may be extremely painful, but I'll get a springy end feel from it. When I come to the one below it and try and push that one, what I'm trying to do is basically reverse the position. It won't do it. So the end feel here will be jammed, and basically it may even provoke some spasm as I do that. So there's two ways of assessing this. The treatment for both of these is long traction, and depending on where this subluxation exists, I'll either be fixing the vertebra below and lifting it if it's higher up, or fixing the vertebra above and dropping the one below if it's a lower one, where I can use gravity to assist.